Hello, and thank you for joining us today for the Cigna Preventing Type 2 Diabetes featuring Omada presentation on the second week of open enrollment. My name is Jose Rodriguez, and I'm part of the benefits team. Before we begin and I introduce our presenters, I would like to go over a few housekeeping rules and presentation format. If you called in using the conference ID option, we would like to ask you to mute your device if you haven't done so already. Our live event is scheduled for 30 minutes. The first half will consist of our vendor presentation and then followed by the Q&A session. If you have any questions, please submit them using the Q&A section on Teams. For individuals who called in, your questions will be taken at the end once we finish with the written questions. Now let's go ahead and begin our live event. Today's presenters are Raquel Downs, our Cigna Wellbeing Coordinator, and Devin Gangler, our Cigna On-Site Engagement Advisor. Go ahead, Raquel.
Great. Thank you, Jose. Hi, everybody, and thank you for joining today to learn more about preventing type 2 diabetes. As Jose said, my name is Raquel Downs, and I'm your dedicated well-being coordinator. Just a few housekeeping rules so you understand and know the expectation of this presentation. So this presentation is for informational purposes only. Material within this presentation should not be considered medical advice. And if you should have questions following the presentation, please consult with your doctor. And for more information or support with Cigna, you can actually call Cigna's customer service to talk to a nurse at the 24-hour health information line listed here at 1-800-CIGNA-24 or 1-800-244-6224. For today, we will be looking at understanding type 2 diabetes, recognizing the signs and symptoms, and how you can lower your risk. Diabetes, type 2 diabetes is actually a chronic condition that occurs when your blood glucose, also called blood sugar, is too high. So glucose in your main source is your main source of energy and comes from the food we eat. Insulin, of course, is a hormone made by the pancreas, and it helps glucose from food we eat get into your cells to be used for energy. If you do have type 2 diabetes, your body, there's two ways that will help that this forms is your body does not make or use insulin well, therefore not fueling your body properly and what it needs to be used for. You can develop type 2 diabetes at any age, even during childhood now. However, this type of diabetes occurs most often in middle-aged or older people. Type 2 diabetes is actually the most common type of diabetes, where and a study shows as of 2015, there are about 9% of the population in the United States has diabetes. And diabetes affects 1 in 4 people over the age of 65, where one in 4 of those people didn't even know they had diabetes. So it's definitely a high risk type of chronic disease with a lot of the population in the United States increasing as far as who has this chronic condition. When it comes to fueling our bodies, there are 4 key points to understand with type 2 diabetes. So glucose provides energy for your body. We've talked about that. So to think and to move as well. We also need glucose comes from food. So just like we've talked about carbohydrates, there are other variations of that, like starches, fruits, milk, and sweets. Insulin in your body is what is needed to get, of course, glucose from the food you eat into your cells. So insulin is basically the key you need in order for your body to metabolize and use the blood sugar level it's needed for, or blood sugar in order to fuel your body for energy. Once, of course, the insulin is in your cells, of course, it's a way for the glucose to be used or stored as energy for later use. So let's look a little bit more at a glance so you kind of know the process and how it goes on. You might know already, but glucose comes from 2 major sources like we talked about, not only food, but also from your liver. So Sugar is absorbed into the bloodstream, where insulin, of course, is the key that unlocks the glucose in order to be used. It is made and it helps the glucose enter the cells, right? So that's the function of the insulin. If your body doesn't produce enough insulin, or the insulin doesn't function as it should to help enter the cells, then that's where the blood sugar levels increase in your blood, that can cause prediabetes or type 2 diabetes. And we've talked a little bit about type 2 diabetes. It's important to also note the difference between type 1 and type 2, even though they're both forms of diabetes. There are similarities, but there's a significant difference, so you know what is going on. And of course, it's good to know what the significant difference is between these two chronic conditions. So type 1 diabetes is usually diagnosed in childhood, right? The early onset of childhood diabetes is what they used to call it. However, that can be sort of different nowadays as we've evolved. But people that have type 2 diabetes get it when their immune system attacks the cells in the pancreas that produce insulin. So these cells are destroyed within the pancreas and they do not produce insulin anymore. So essentially, of course, the pancreas is not functioning well. And that's when insulin shots are required for life for the individual that has type 1 diabetes. So they, of course, do not produce the insulin, and the insulin, as we know, is the key to unlock for the body to use the blood glucose in our body as fuel. And of course, the body is not able to make that, so that individual needs insulin shots in order to at least go through that process of utilizing and metabolizing the blood glucose. Type 2 diabetes can be diagnosed at any age, but it's often diagnosed later in life. With type 2 diabetes, your body does not make or use insulin well, so that's the major difference there. The good news is that it can be prevented or delayed with a healthy lifestyle. It is important to know the signs and symptoms, of course, of type 2 diabetes so that you can be prepared. Maybe if you start noticing these signs and symptoms in yourself or maybe a loved one, these are very ways that you can get help or seek help or treatment early if you see these. So the signs and symptoms often develop slowly or over time. So it's always good to listen to your body and pay attention to any changes or differences, and always make sure you talk to your doctor about any changes that you might see here. Okay. In fact, if you do have type 2 diabetes for years, and you can sometimes not know it. So it's really important for you to start knowing these signs and symptoms and understand what they mean if there's been a change in your lifestyle overall. And of course, like I said, communicate with your doctor so that way you can, your doctor can do further testing or investigation if necessary. Type 2 diabetes can easily be ignored, as we've talked about, right? Especially because in the early stages, you might feel fine or you might not see any significant changes. But when you start seeing those changes, it's very important, as I've talked about, is to recognize those and not to dismiss them, but see if you can start seeing a pattern. And the reason being is because there are some potential complications from ignoring if you have type 2 diabetes. As you can see here, okay, it can affect major organs, including your heart, blood vessels, nerves, eyes, and kidneys. So that is something that to consider there. Individuals with diabetes are 2 to 4 times more likely to suffer a stroke or die of heart disease. So of course, if these complications are not addressed quickly, or your signs and symptoms, it definitely could lead to some more serious complications as listed here. So now that you know what type 2 diabetes is, the signs and symptoms, let's talk about what you can do to lower your risk, right? So focus on the things you can change rather than those that you can't. So let's work towards that. So being overweight is definitely one that we can work towards improving. So managing a healthy weight or reducing your weight is helpful. Keeping your BMI measurement, which is a measure of your weight relative to your height, within ranges that are appropriate for you. If you need more information on that, we can post it in the chat here in a minute of where you can see what your BMI is, which is relative from your weight to your height. Or if you want to speak to your doctor, you can ask your doctor what your BMI is and what recommendations he or she might have. Your waist measurement is also very important to note there. And your waist measurement should be less than 40 inches around for men and less than 35 inches for women for weight. Other categories here, of course, is controlling your blood pressure. That should be less than 140/90. And managing your cholesterol levels is specifically mostly your high density lipoprotein, or your HDL, which is also considered the good cholesterol, will combat all of your bad cholesterol or triglycerides in your body. And that, of course, is something you also want to talk to your doctor about, what your target range is for your blood pressure, cholesterol, and triglyceride numbers should be. And they can, of course, guide you what that might look like and what is an appropriate range for you. Inactivity, being physically active, of course, can help you prevent type 2 diabetes or manage your symptoms. A poor diet, of course, having processed and unrefined grains, and smoking. So these are things you can alter throughout your life, doing some lifestyle changes or healthy behavior changes over time. Some things that you cannot change that are basically a part of your genetics, okay, is your age. Older than 45. It puts you at higher risk for type 2 diabetes. Genetics and a family history, and certain ethnicities have a higher risk. And that is something that, of course, you cannot change. However, what you can do is focus on the prevention and lifestyle changes that we talked about in order to lower your risk. Now let's continue on the topic of lowering our risk and the behavior changes you can do to minimize that risk. So talking a little bit more about smoking here. So smoking, of course, harms nearly every organ of your body and your health. It also can lead to premature death. For more information, for support, there are several options that you do have. So you can visit smokefree.gov for information and helpful tips on how to quit smoking. Or if you are a Cigna member, you can join the Lifestyle Management Tobacco Cessation Program at no cost to you, and it's confidential as well. You can talk to a dedicated health coach who can help you on your journey to quit successfully and have support there. So breaking the habit is, of course, not easy, and it is a lifestyle change and something that can be done with support, maybe talking to your doctor about medication, again, joining a support group, or like I've talked about, the health coaching options that you do have for one-on-one individual support throughout your journey. And let's get a little bit more into, of course, weight. So maintaining a healthy weight is ideal for preventing type 2 diabetes as well. Losing the modest amount of weight, even just 5 to 10% of your body weight, has significant health improvement capabilities and can help delay or prevent type 2 diabetes. And talking a little bit more about healthy eating plan and healthy foods is something that you want to try to balance, eating foods from each food group and adding your daily intake of fruits and vegetables if you haven't. You can also, of course, make sure you have a high fiber, low sodium, and low sugar intake. Here are some suggestions as you see here, and do your best to start maybe limiting or cutting out any fried foods or foods high in salt. And of course, sweet treats and beverages with too much sugar is helpful. Okay, and we'll talk a little bit more here about healthy tips that you can start off with in changing your unhealthy eating and healthy practices, of course. You should look at this as not as a diet or a short-term solution, to helping either manage or prevent type 2 diabetes when it comes to healthy eating, but more so as a lifestyle change and one that can be sustained over time. So always make sure to remember to take your time and slowly add in new tips you might see here that you haven't tried that could be helpful along your journey. As we talked about, being physically active is also a great way to lower or manage your type 2 diabetes. And one of them is being physically active, especially important in preventing type 2 diabetes. When combined with, of course, healthy eating, like we talked about, it can help keep those blood glucose levels under control. Also your blood pressure and cholesterol as well. You should aim for at least 30 minutes of moderate to vigorous physical activity 5 days a week. And this may not mean that you have to do a whole 30 minutes at one time, but maybe it's more of you managing a time that you can do maybe bits and pieces. Every little bit can count. So maybe, for example, doing 10 minutes in the morning, 10 minutes, of course, during lunch, and 10 minutes for dinner. Now, I know we're in the middle of summer here. It's actually a nice day today, but we'll be going up into the triple digits again starting tomorrow. But finding a time that works better for you. Maybe it is more 15 minutes early in the morning and 15 minutes in the evening. That might be better suited for you if you live here in this lovely heat. Okay, so finding a way that you can stay physically active, maybe going out for a brisk walk or doing a physical activity that brings up your heart rate that you enjoy. You can do that. So to help you on your way to creating a healthier lifestyle, especially talking about type 2 diabetes, Cigna is here to support you in what that might be. You have access to a variety of programs and services to help you. And as a Cigna member, we'll go ahead and talk through these. So the fitness discounts here through Active and Fit Direct is available to you. It offers fitness center memberships to over 8,000 fitness centers nationwide, but also since we are in the middle of social distancing, you can have access to over 800 on-demand workout videos for $25 a month. So you can do it in the convenience of your own home. There's no contract and with the ability to cancel at any time. So for more information about that can be found if you visit www.tucsonaz.gov/wellness, and you can find that under the fitness opportunities. Talking a little bit more about mycigna.com, you can access my Motivate Me incentive goals there. And Motivate Me is an incentive program that rewards you with points for taking actions to improve your health. Here you can get information also. This is available to active city employees who are on the Cigna medical plan as the primary subscriber in this program. So dependents over the age of 18 can participate in the Motivate Me incentive program, but are not eligible for a chance to win the incentive dollars, but can still participate and reap the rewards of healthier lifestyle. You also have access to the 24 health information line where you can speak to a nurse to discuss questions regarding your health or enroll in one of the free and confidential coaching programs offered to you as a Cigna member that I had mentioned earlier in this presentation. You can work with a dedicated health coach with setting goals to improve your health through the lifestyle management program in weight, tobacco, or stress. Or if you are managing your diabetes, you have access to talking with a dedicated nurse through the Your Health First program. They can help you, coach you through managing your diabetes on a one-on-one level. Again, as mentioned before, it is free and a confidential service to you as a Cigna active employee. As a City of Tucson employee with Cigna benefits. Again, you can access this information at tucsonaz.gov/wellness for details on all of these programs and other wellness programs that might be available to you. Another service that we want to mention that is available is the new Omada Diabetes Prevention Program that has been added to this year's Motivate Me incentive program. It's a digital behavior change program designed to help you lose weight, reduce the risk of type 2 diabetes and heart disease. This program is for individuals who are not type 1 or type 2 diabetic. It is more so a prevention program to help prevent those chronic conditions from occurring. This program is a personalized participant experience program with virtual guidance and support from a dedicated Omada health coach. There's also a social support group, a digital scale, interactive online lessons, and technical support throughout the program. It is available at no cost to you or your covered adult dependents if you or your adult dependents are enrolled in a city medical plan offered through Cigna and also meet the eligibility requirements to be accepted into the program. To find out if you meet the program eligibility requirements and if it's a good fit for you, you can visit the website listed here at www.goomadahealth.com/COT and click on Am I Eligible? If you are eligible, Omada will confirm you are a participant and you'll start on July 1. You can also visit www.tucsonaz.gov/wellness for further information on this program as well. Lastly, I wanted to take this time to remind you or introduce you to your dedicated team that you have. I'm your Cigna Wellbeing Coordinator, and my role is to help strategize, implement, and manage your health and wellness programs and events. I educate you on all your wellness benefits and provide information on the Cigna services that are available to you as a Cigna member that can help you manage or improve your health and well-being. If you ever have any questions about any of your wellness programs or Cigna's wellness services, feel free to reach out to me at the phone numbers listed here, or you can email me at raquel.downs@cigna.com. And you can also visit your wellness website, as I've mentioned before, for the most up-to-date information on all your city employee wellness programs and events. My colleague, Devin Gangler, is the dedicated engagement advisor here for the city of Tucson, and her role is to educate you on your Cigna benefits, explain insurance terminology, and help you better understand your medical plan options. You can reach her with any questions at the phone numbers listed here or email her at devin.gangler@cigna.com. You can also access information on your city insurance benefits at www.tucsonaz.gov/insurance. For any questions, please feel free to reach out to any of us at any time. I hope you found this presentation helpful today, and I want to pause here to see if we have any questions that we'd like to review. Jose?
Thank you, Raquel, for that presentation. I did go ahead and post the wellness website on our chat, as well as the Motivate Me flyer, if anyone's interested, and the Omada handout, as well as the benefits website as well. As of right now, we don't have any questions. Is there anything else you'd like to add, Raquel or Devin?
Yes, I'm going to go ahead and post in the chat here I had mentioned in the presentation of the BMI and how you can calculate that or know what your BMI is. I put that in the chat for you to go ahead and use. It's a BMI calculator as well, and that could be helpful. And one last thing, I'll go ahead and also add in the wellness website for a quick link in the chat today. So if there's no other questions for me, thank you for your time today. And Jose, I'll let you go ahead and close us out.
Thank you, Raquel. Yes, like Raquel said, we're going to go ahead and end tonight's event. If you are interested on Motivate Me or mycigna.com, we do have a follow-up presentation tomorrow, like I mentioned, regarding Cigna Motivate Me and My Cigna demo from 1 to 2 p.m. So if you have questions, definitely join us, and we'll be there to answer them. Thank you for joining us today. And with that said, we'll end tonight's event. Thank you.